Yes, hello viewers, welcome to Dr. Your everyday doctor, your answers to your medical concerns. And today we are going to talk about ovulation. Ovulation. What is ovulation? How is ovulation important? And specifically, the signs and symptoms of ovulation, the signs that show that you are in ovulation. Just to give you a highlight, ovulation is the process of releasing an ovum or an egg from the woman's ovaries to the ampulla where it's supposed to be fertilized from. So it is important to know this day because when you know this day, you will know that day exactly to have productive sex, to have sex and become pregnant. There are a lot of women who have no reproductive issues. They don't have any reproductive problem. The hormones are okay. The functionality, they don't have any masses, no uterine masses, no fibroids, no nothing. But the only problem that they have is either irregular periods or inability to calculate the rightful ovulation day. So today we are going to look at the signs and symptoms that shows that you are in ovulation. It is important for you to know. It is very important for you to know in order to save time and have a child and conceive. This is also very important, especially for people who are in long distance relationships, people who are in long distance relationships. So it helps you plan prior and know when to travel, when to meet your boyfriend or husband, and when to have productive sex. Why? Because ovulation happens for only 24 hours. Once it exceeds 24 hours, the egg or the ovum that has been released becomes void, becomes nullified. It's no longer able to be fertilized to make a baby. So it is important for you to know this day. These 24 hours will be very, very crucial for you. They will be very crucial for you. So when we have to look at the ovulation and the signs and symptoms, since we have known that ovulation is the day that helps someone, or that the day that someone will be able to get pregnant within the cycle. So if you know these signs and symptoms, it guides you and helps you know about the factors that we have talked about. Some of the signs and symptoms that we have is one, breast tenderness. When someone is in ovulation, the breasts are tender. This is actually not a sign, but it's a symptom. It's a symptom. It means it's the owner who will feel the symptom. When the owner touches the breasts will seem to feel some kind of pain. Not really so much pain, but they will feel some kind of pain after stimulation or after touching, after being touched. Still looking on the breasts, these breasts are enlarged. These breasts are enlarged. It's not to say that they will be so much enlarged that they will change. Still, this will be more like a symptom to the owner, the female, the woman. You will be able to see and note some slight change that the breasts have enlarged because of the hormones that are involved in the process of ovulation, the luteinizing hormone, the estrogen, and all those hormones. Your breast gets enlarged a little bit, and it can be noticed by you, who is the owner. So the breast becomes tender and enlarged and somehow change in the size. Then the other symptom is heightened senses. Heightened senses. These senses are usually either hearing or smelling or taste. Hearing or smelling or taste. They will have a very functional olfactory system that they can smell even the smallest thing. They can smell even something that is kind of far away from you, the normal person, or us, the men who are not in the ovulation at that time, or anyone who is not in ovulation at that time, will not be able to smell. Or they will be able to taste. They will have a high sense of taste in the mouth. So it is also important to look at that, to know that the taste will change. Change in temperature. There will be a change in temperature. The temperature, if the woman has been, if you have been cautious enough and you've been taking your temperature every morning, this happens to people who are trying to monitor their life so that they have a baby. Yeah, some people do it. They monitor their temperature. They decide a month that this month I'm going to monitor my temperature every morning to see how it is. You realize that the temperature on ovulation day, it will increase by about 1 degree Celsius. For example, if it has been usually 36.7, it can go to 37.6 that day, and you will not feel any feverish. However, you will feel an increase, a slight increase in your temperature. And when you do the testing, the temperature testing, indeed you'll find it having increased. There will be some spotting. There will be some spotting. Spotting means seeing some blood. Seeing some blood. It might not be like periods or a lot of blood, but some blood on your pad or on your nika or that morning. Why? How does this does not happen to everyone? However, it can happen. How does that come about? During the process of ovulation, there are what we call follicles. Follicles rupture so that an egg comes, and when they rupture, there is that blood that has been in the capsule that has been encapsulating the ovum or the egg. So that bleeding, that blood might come out to be blown out. So you end up getting some kind of slight spotting, which you might see. There will be cervical changes. The cervical changes. Your cervix will have a lot of changes. For example, the position, the general feel of it. For example, a normal cervix is supposed to feel like a tip of your nose. When you touch down there, the woman who know, when you touch there, you feel like your cervix is almost like the tip of your nose. However, on the ovulation day, it will be like a tip of your tongue. Soft as the tip of your tongue. Yet the normal days it is hard. Why? Because it is opening and preparing for the sperms to pass through and enter. So it becomes soft and somehow open. You might not see the opening, but you will feel the softness. The other point there is increased sense of libido or increased need for sex in a woman who is in her ovulation. There is that increase because naturally the body knows that this is the day that I can get pregnant. This is the day that we can reproduce. So naturally it increases the sex hormone, the female sex hormone, and you end up getting that high libido, that craving for sex. Usually women who are in ovulation, they have that increased lack or craving or needing or wanting for sex. It is always very common. That is a very common sign and symptom. Now, there is what we call a cervical mucus. The cervical mucus changes and it becomes very wet, sticky, and it resembles like an egg white. Egg white. When you break an egg, not the yellow yolk, but that egg white. When you touch down there on the cervical mucus and do a finger test, this will be sticky and stretchy and sticky, and it does not break easily. You can even stretch it to this extent without breaking. The way you see it here. Under normal circumstances, it is dry and sticky, but not stretchy. It is not stretchy. When it starts becoming wet and watery, then you know you're about to get in your ovulation. And when it starts becoming creamy, you know you're almost going in your ovulation. However, when it is this sticky, like a raw egg white, then you know that is most probably ovulation. To demonstrate this very clearly, let us see how it looks like. Like you can see here, this it becomes sticky. The mucus, the cervical mucus, that it can stretch, in between your fingers when you touch it. Then the other way of knowing that you're in ovulation, you will do a test. You will do a test that checks to see if you are in ovulation. It is important because when you know, you can test. That is this, for example, this test. It is a luteinizing hormone test. When you do this test, you can know the way you check for pregnancy. So it becomes very helpful for you to know the exact date of when to have the productive sex. And then the other way of knowing is by doing a luteinizing hormone test or the LH or ovulation test. This test can be important for you to know when exactly your ovulation is there or to confirm. This test can be like the strips, but it is specifically for a certain hormone that we call LH hormone in your body. When you do it, you can know exactly when the ovulation can happen, when the ovulation has happened that very day. So it means you get a sample and you put it on the test, and you will see two readings, and you know, okay, now I'm in my ovulation. So if you're in your ovulation, it means you can have the baby that very day. It means that very day the ovum has come, and you can get the baby if you have productive sex. So it becomes very important for you to know. It becomes very important for you to know that all these things can be managed. All these things can be handled. All these things, if you take a clear cautious, you can know all these things. I have done another video that shows you how to calculate your ovulation. That shows you how to calculate your ovulation date. For example, there are people who don't know how to calculate. We have people who have regular periods and people who have irregular periods. There are videos for both of them showing you how to calculate both regular periods. For example, people who have a 20 days 8 cycle, and people who have jumbled cycles. Today you go in at 16th, and then the other month you go in on 20th, and then the other month you go in on 11th. Both videos are there showing you how to calculate. So if you integrate the knowledge of calculating your ovulation date, the knowledge of signs and symptoms, you add on the testing, you will get the exact ovulation date and you will have productive sex to have a baby. So thank you very much. Thank you for following. Thank you for liking and commenting, and during the videos, if you haven't followed, you may follow so that you get notified in case we upload any important video for you in the long run. Thank you.